My name is Ronnie Poe Beltran-Yu. I'm a registered nurse here in Nunavut. I've been working up north in Nunavut since 2013, and I was an international educated nurse. I came from the Philippines and I went to Canada on 2008, and I've been working as an emergency room nurse in Prince Albert, and also I was doing some work in medical palliative ward as well. Well, right now I'm currently working in Arviat in Nunavut. So this is the southernmost community. And aside from Arviat, I also work sometimes in Baker Lake and Coral Harbor. I've been in Whale Cove. And most of the time I was just assigned there to do and help with the community in terms of whenever they have emergency. So I usually go to those community to help. So I've been a nurse since 2006, and I passed my exam in the Philippines last 2006. And then after that, I went to Canada last 2008 and luckily passed the exam at the same time. And I've been working in Nunavut since 2013. So that's going to be like almost or more than 8 years when I started working up north here in Nunavut. Working up north is actually very challenging. So when I started up north, I have no idea what's gonna be in here, and my first impression was I was just saying to myself, oh, I'm just gonna be here for 6 months. And after that was 2013, and I'm still here in the north. Working up north will actually fulfill my dreams and goals, and it provided me more experience beyond my dream that you can never imagine. And aside from that, I did actually gain more knowledge, more skills. I interact with more people, especially with locals. It's really nice to interact with the locals up here. Well, my memorable experience in my practice was actually doing a delivery in the middle of blizzard. So when you have a blizzard here in Nunavut, like when we say blizzard, like you can't see anything, like it's just white, like you cannot go out, like everyone just stays home. And then that day, I was a nurse on call, and that was around 9 p.m. and it's kind of like dark, and you can't see anything outside. So, and then I got a call about a lady that's she thinks that she's having a baby. So I have no choice but to see the client because she's pregnant and she said that she's having a baby. So what I did, I actually asked, because there's no road, like I can't drive. There's no road that time. Everything was just covered with huge pile of snow. And I actually asked one of the family member to drive me to the health center using a skidoo. So that was that was my first time riding a skidoo in the middle of blizzard, and I thought it was fun. I also did I think that was 5 years ago when we had a call from one of the family that has an elder that was stuck in their cabin, and their cabin was like 9 hours away from our community. So by ATV, if we drove by ATV, it will be like 9 hours. So what we did, we actually hired a plane. So I was sitting beside the pilot and we went to the area, and that was like almost 2 hours flight. And it was so funny because the pilot was asking me to actually do some pedal, and then I was actually helping him to fly the plane on his command. So those were the experience that I had here. When the patient comes in to the health center, you're lucky actually if you have a doctor here up north. But if you don't have a doctor, that's when a full scope of practice kicked in. You actually need to do your full scope of assessment, and then you need to do your own planning based on your assessment and based on the guidelines from the book which we use. So we have guidelines here that we use in order to manage our patient here. Arviat in Nunavut is the first community that got hit by the COVID-19, and that was November. And after that, everything was changed the next day after we received the news that we have a case here. I was one of the nurses that was working that day, and then in the minute, like after we knew that we have COVID, after that we're down to like two nurses, just me and my nurse in charge. So it was really hard because there's only from 9 nurses, we're down to 2 nurses, and we were just working hand by hand, and just 2 of us. It's actually able to give me more knowledge, and it actually helped me with regards to coping skills. And also, we were dealing with this COVID for almost a year since November, since the first case, and actually it really helped us. It really helped me, not just a nurse, but it actually helped me in terms of working hand in hand with other team as a team approach, and also working hand in hand with the community. And aside from that, it also helped me with regards to meeting the demands and the challenge as a nurse, and also as working as a team lead for the rapid response team for COVID-19 in our region. The support that we actually needed as a health center and a nurse was actually getting more nurses. Actually, we have problems with retaining and getting more people to work up north, and that is a very challenging, especially with working up in the health center. We're supposed to be like 7 or 9, and then most of the time, like we're only working as 4 to 5 nurses, so we're usually down to 5. Well, most of the time, the reason why we have shortage of nurses in the north is because of the working conditions. When you work up north, there's lots of challenges, especially if you never been up north. Like most of the time, you will be dealing alone. You were dealing with your cases without a doctor. So I think that's one of the reasons why we're having some issue with retaining some nurses, because most of the time you're going to be doing your own assessment, and you're going to be doing your own treatment and plan for your patient. I think what support what we need from the government, or from the government of Nunavut in Gen, is to make sure that all the nurses will get benefited from getting what they need to get as a worker and as a nurse. In the summer, we like people here, they like going out in the cabin, and we have other local co-workers, like our clerk interpreters or like our maintenance that has a cabin. So we go there, we have like barbecue, we had fun in their cabin, and then they usually do hunting. Like we have lots of hunters here. Like people here will hunt caribou, polar bears, like birds. They usually do that. And then on winter, they usually do fishing derby. Like when you get the longest fish, then you get more prizes. Sometimes it goes up to like 15,000. I always like to travel. So here in Nunavut, I was so lucky that I was able to get some holidays. Like sometimes I was able to go out twice a year for 2 months. And by doing that, I was able to travel in all different places. So that's what I like to do when I'm not working. Like I like traveling and go back to the Philippines and see the spots there.